Have you ever wondered why do you still get acne when the fact is you are not even a teenager anymore? Remember how the older adults always said, "Oh, don't worry, you will grow out of it." Or what about those who had flawless skin during your teenage years, but now when you are an adult, you suddenly develop severe acne? I'm in my mid-30s and I still get acne too. So today I will discuss on what are the reasons for adult acne. Hi, my name is William and I share science-based evidences on products, claims and effective methods related to health and beauty concerns so you can make an informed buying power. If you're new to my channel, do consider subscribing as I upload new videos on Fridays and click on the bell icon to get notified of new videos. Also, do follow me on Instagram and Facebook for more contents that I wouldn't post here on YouTube. When available, links to cited articles are provided in the description below. Adult acne is defined as acne that occurs after the age of 25. Unlike its adolescence form, which are equally distributed between both sexes, adult acne, however, predominantly affects females. Almost 85% of adult acne sufferers are women, and it is getting more and more common these days that dermatologists even have a specific management just for adult female acne cases. Variations in the prevalence of the disease among different ethnic groups have also been reported. A study on about 2,900 women of different ethnicities showed that acne was more prevalent in women with darker skin types, like African American and Hispanics, versus in those with lighter skin, with Asians being the top, followed by Caucasians and Indians. Based on the time of onset, two subtypes of adult acne can be described: persistent acne and late onset acne. About 70% of adult patients showed persistent forms of acne since puberty, while the remaining 30% persisted a late onset type of adult acne. Two clinical profiles of adult acne has been described. One shows hypersebum production, which is increased production of oils on the skin, and non-inflammatory lesions diffuse in all areas of the face with abundant open or closed small comedons. In other words, many blackheads and whiteheads, which are mostly prevalent in Caucasians, while the other consists of predominant red, angry-looking inflammatory lesions, long-lasting nodules, and cysts on the lower one-third of the face, neck, and jawline, and affects Asians the most. Now, what causes adult acne and why does it affect females the most? The pathogenesis of adult acne is very complex. Similar to adolescent acne, the pathogenesis of adult acne involves an interplay of these four main factors: excess sebum production due to androgenic hormone stimulation, abnormal keratinization within the follicle, bacterial colonization of the pilosebaceous duct by acne bacteria called Propionibacterium acnes, and inflammation. Genetics also play a strong role, with 70% of patients have a first-degree family history of adult acne. People who have this predisposition be more likely to get adult acne. Several other factors have been postulated as triggers or aggravating factors. I'll start with diet. Studies have shown that consumption of high glycemic and dairy foods increases level of insulin and insulin-like growth factor 1, or IGF-1 in short. These hormones increase levels of oxidative stress and inflammation, thus promoting the development of acne. These hormones increase levels of oxidative stress and inflammation, thus promoting the development of acne. The elevation of IgG1 levels also stimulates the production of androgens, which are associated with the production of sebum and thus development of acne. The consumption of milk also generates an increase in IGF-1 production by the liver and increase in circulating insulin levels. Hence, milk consumption has similar consequences as high glycemic load meal. In addition to this, worsening of acne by the use of dietary supplements for muscle mass gains that are rich in branched-chain amino acids and peptides derived from whey is observed too. Stress and sleep deprivation. In another study, job stress was associated with more severe forms of acne in women. Women with localized acne were also more likely to report higher stress levels and a psychologically stressful job. Recent studies show that sleep deprivation associated with women's modern lifestyle and stress have an important impact on the hypothalamic pituitary adrenal axis and an increased secretion of stress-related hormones, and may also be an aggravating factor for acne. Tobacco. It was also reported that there was a significantly higher proportion of subjects with severe acne among smokers in comparison with non-smokers. Smoking has been related with abnormal follicular keratinization and inflammation through lipid peroxidation of sebum in comedons by inflicting oxidative stress. Hormones and the menstrual cycle in women can influence oil production in the skin that leads to frequent breakouts. Use of pore clogging, hair, skincare, and makeup products together with some medications like corticosteroids, anabolic steroids, and lithium can also cause acne. Endocrine diseases like polycystic ovarian syndrome or PCOS. Women with PCOS frequently experience hyperinsulinemia and peripheral insulin resistance. And other factors like excessive exposure to ultraviolet radiation, obesity, excessive skin washing, and possible resistance to P. acnes bacteria. Currently, the deficiency of the epidermal barrier function has also been reported as a relevant change. The damage of the barrier and the consequent increase in transepidermal water loss may be responsible for the onset of the inflammatory cascade that constitutes the central change in the onset of acne. As you lose more moisture from your skin due to the damaged skin barrier, it will counteract with an overproduction of sebum as a protective mechanism. This will inevitably lead to acne. While adult acne is mainly mild to moderate in severity, treatment failure and a chronic relapsing cause may increase the self-perception of symptoms severity with a resulting negative impact on one's quality of life. So there you have it, the causes of adult acne. It is important that we understand the causes so that we can tackle the root cause for effective treatment options. I will discuss on adult acne treatments in my next video. If you haven't already do so, please click on the subscribe button now and the bell icon to get notified so you don't miss out on my next videos. I'll see you all next time. Bye bye!